Hi everyone, my name is Kate Warnock and I'm coming to you from the GuideWell UST Global Innovation Center here in beautiful Lake Nona. Delighted to have our next guest with us here in the Insights Lounge, Ken VanCara. How are you?
I'm great.
So Ken, I know from your background that you really are an expert in value-based models, so we're going to ask you several questions around that today.
Okay, fantastic.
Okay, so over the past few years, how have models for healthcare financing been changing?
I really think about sort of two major events in that. And the first is that we've been driving towards models where providers take or share risk. And that's a fairly recent development, and it does change things a lot because it changes the way that incentives are aligned in healthcare. It used to be the health plan's job was to manage costs and the physician's job was to do medicine. And now there's a mix of those two things, and there's less distinction between those. And we see all kinds of new models coming together as a result of that. The other thing, and this is possibly the more obvious one, is that there's a strong move away from fee-for-service models to models which say, let's pay for collaboration, let's pay for outcomes, let's pay for value generation. And I think that's positive. I think that's really, it addresses a lot of the challenges that we see in healthcare today, but it certainly doesn't address them all. And so there's still more to do to solve that equation.
Right. Well, I wanted to hear your perspective. Here we are, the end of day one of the Greater Than Cancer Immersion event here at the Innovation Center, and specific to the cancer experience, how do you see that value-based care model really improving the cancer patient experience?
When I think about it from a patient perspective, first of all, better coordination of care. And cancer care, because it's complicated, often has teams of physicians who are involved in the care in one capacity or another. You'll have an oncologist, you'll have a surgeon, you'll have a radiologist, you'll have a lot of players in the mix. And so that enhanced coordination amongst those entities is really going to make for better care and better outcomes in the long run. But I think the other thing, and maybe the more immediate piece, is that if my costs are predictable as a patient, and as a payer or health plan as well, but as a patient, if I can have some idea what I'm going to pay for my care, that takes a whole level of burden out of the cancer experience that currently is a huge burden. People don't know what they're going to pay until all the bills come in.
Right.
And they don't know until that lag is up. And you hear the stories about people suddenly seeing hundreds of thousands of dollars in bills coming in, the shoebox claims. So I think that's a big change in the experience.
And so many of the conversations that we've heard here today, Ken, have really focused on the human side of care delivery, and not forgetting it's not just the technology, it's not just the medicine behind the cancer treatment, it's everything else that impacts that person and their caregivers. And so I think not many people would naturally assume that payment models have a role to play there, but as you just described it, they certainly do. They alleviate some of that stress, and they also help with that integration so that there's maybe a few less things for them to navigate when it's already kind of been defined for them.
Healthcare, not just in cancer, but across the board, has a couple of major problems. One of them is fragmentation, and one of them is misaligned incentives. And if nothing else, value-based payment models where physicians share in creating that value has the potential to align incentives. So it gets at one of the major problems.
Right, terrific. Well, so one last question for you then, Ken. Our whole point of convening experts such as yourself, all these different industry stakeholders, is really to try to define the problems that are preventing us from having a more ideal patient experience. In your opinion, what does the other side of cancer care look like? And what elements really have to be in place?
So the other side of cancer care involves having the right tools and the right team at my disposal as a cancer patient. So I have peers that have gone through a similar diagnosis and experience. I have good and clear, transparent information about what my treatment alternatives are, and I can compare them on a cost basis, an outcome basis, a side effects basis. Cancer care has to be driven by understanding what the patient's goals are for healing and recovery. It's not all patients have the same goals, and you might choose different therapies based on what your needs are and what your family needs are and what your family planning needs are. There's got to be a lot better coordination with the caregiver. There's got to be a better emphasis on palliative care. So I think we're making strides in that direction, and I do think that the oncology model that's coming out from CMS starts to address some of that. But there's a lot more to do here, and this has been a really exciting day today. I'm looking forward to tomorrow, where we talk a little bit more about what some of those solutions are. But it's also a hard day, because oncology is hard in that cancer has devastating effects for people. Right. And that's why it's so important to solve it.
So the stakes are so high, but I really truly believe that GuideWell, American Cancer Society, individuals like yourself are committed to really helping to move that needle forward, and I'm grateful that you're here. So, thank you so much, Ken, for sharing your time with us.
Thanks so much for having me. I think we're going to make it a whole lot better.
I hope so too. All right, my name is Kate Warnock. Thank you for watching.